Hi, I am Nur Atirah Nabilah binti Omar and I am going to present about Diabetes Mellitus type 1. Diabetes mellitus is a group of metabolic disorder in which there are high blood sugar levels over a prolonged period. Diabetes occurs in one of the following situations. Situation 1. The pancreas, an organ behind your stomach, produce little insulin or no insulin at all. Insulin is a naturally occurring hormone produced by the beta cells of the pancreas, which helps the body use sugar for energy. Second situation, the pancreas makes insulin, but the insulin does not work as it should. This condition is called insulin resistant. There are three main types of diabetes mellitus. Type 1 result from the pancreas failure to produce enough insulin due to loss of beta cells. This form was previously referred to as insulin-dependent diabetes mellitus or juvenile diabetes. The cause is unknown. Type 2 begins with insulin resistance, a condition in which cells fail to respond to insulin properly. As the disease progresses, a lack of insulin may also develop. This form was previously referred to as non-insulin dependent diabetes mellitus or adult onset diabetes. The most common cause is excessive body weight and insufficient exercise. Third, gestational diabetes is the third main form and occurs when pregnant women without a previous history of diabetes develop high blood sugar levels. It only occurs on a pregnant woman. To better understand diabetes, it helps to know more about how the body uses food for energy, a process called metabolism. Your body is made up of millions of cells. To make energy, the cells need food in a very simple form. When you eat or drink, much of your food is broken down into a simple sugar called glucose. Glucose provides the energy your body needs for daily activities. The blood vessels and blood are the highways that transport sugar from where it is either taken in the stomach or manufactured in the liver to the cells where it is used in muscles or where it is stored in fat. Sugar cannot go into the cells by itself. The pancreas releases insulin into the blood, which serves as the helper or the key that lets sugar into the cells for use as energy. When sugar leaves the bloodstream and enters the cells, the blood sugar level is lowered. Without insulin or the key, sugar cannot get into the body cell for use as energy. This causes sugar to rise. Too much sugar in the blood is called hyperglycemia, that is high blood sugar or diabetes. On this presentation, the case study present of the 18-year-old woman who was diagnosed to have type 1 diabetes mellitus who developed a year later. Type 1 diabetes mellitus is most common at young age. Most of the patients have short duration of symptoms. Pathogenesis. The autoimmune destruction of pancreatic B cell leads to a deficiency of insulin secretion, which results in the metabolic derangement associated with type 1 diabetes mellitus. In addition to the loss of insulin secretion, the function of pancreatic A cell is also abnormal, and there is excessive secretion of glucagon in type 1 diabetes mellitus. Normally, hyperglycemia leads to reduced glucagon secretion. However, in patients with type 1 diabetes mellitus, glucagon secretion is not suppressed by hyperglycemia. The resultant inappropriately elevated glucagon levels exacerbate the metabolic defects due to insulin deficiency. Although insulin deficiency is the primary defect in type 1 diabetes mellitus, there is also a defect in the administration of insulin. You can see the chart here, how it starts with autoantigens, genetic and environmental factor, and then the activation of Th1 cell, and the release of cytokines, and the insulitis, inflammation of B cells, death of the B cells, and therefore causing the type 1 diabetes mellitus. Deficiency in insulin leads to uncontrolled lipolysis and elevated levels of free fatty acids in the plasma, which suppress glucose metabolism in peripheral tissues such as skeletal muscle. This impairs glucose utilization, and insulin deficiency also decrease the expression of a number of genes necessary for target tissues to respond normally to insulin, such as glucokinase in liver and the GLUT4 class of glucose transporter in adipose tissue. Explain that the major metabolic derangements which result from insulin deficiency in type 1 diabetes mellitus are impaired glucose, lipid, and protein metabolism. Approximately 85% of patients have circulating islet cell antibodies, and the majorities also have detectable anti-insulin antibodies before receiving insulin therapy. Most islet cell antibodies are directed against glutamic acid decarboxylase (GAD) within pancreatic B cells. Symptom: the following are symptoms of type 1 diabetes. First, excessive hunger. Second, excessive thirst. Third, blurry vision. 4, fatigue. 5, excessive urination. 6, dramatic weight loss in a short period of time. Case study. An 18-year-old girl visited Avicenna Specialist Hospital on 1st February 2007. Apparently, the girl complaining that she keeps urinate frequently at night. The practitioner ordered a urine analysis test. The result obtained shows no significant result for diabetes. Shows in Figure 1. The practitioner sets an appointment for 5 days onwards to test for renal function test. The result obtained shows no sign of abnormalities either. You can see in Figure 2. A year later, on April 2008, the specialist read the diagnosed history and same complaint of the girl. Therefore, the specialist ordered to do HbA1c test, and the result obtained is higher. For people without diabetes, the normal range for the hemoglobin A1c level is between 4% and 5.6%. Hemoglobin A1c level between 5.7% and 6.4% mean you have a higher chance of getting diabetes. Level of 6.5% or higher mean you have diabetes. In Figure 3 shows that the girl HbA1c is 8.1% or in 8.2%. An appointment was set for a follow-up test 2 months after. On June 2008, the specialist ordered for renal function and HbA1c test. The result of the HbA1c shows constant percentage, while the renal function test shows higher cholesterol level. You can see in Figure 2 and Figure 3. Diagnosis. The history report confirmed that the girl are diagnosed with diabetes. The considered type of the diabetes are unknown, but most young child are classified as type 1 diabetes mellitus. The same tests were done at next appointment on August 2008. The result of HbA1c are a lot higher than before, and total cholesterol and glucose level also higher in renal function test. You can see in Figure 2 and Figure 3. The treatment was suggested by the specialist, and the follow-up tests were done a month later. A month later, a urine analysis, renal function, and HbA1c tests were done. The result obtained shows glucose level have a slight decrease, and the total cholesterol and HbA1c maintained. The urine tests were done 2 times, both morning and evening. as a confirmation. The result shows 3 plus on glucose and ketone. There is also a presence of a bacteria, figure 1, figure 2 and figure 3. This shows that the patient's immune system might have been destroyed. Therefore, this confirms the patient to have diabetes mellitus type 1. The follow-up urine analysis tests were done a day after the treatment. The results were a lot better. No sign of glucose in urine. This is the laboratory investigation. You can see in figure 1 is the urine analysis, figure 2 renal function test, and figure 3 HbA1c. Treatment and prevention. Specialists believe that type 1 diabetes is hereditary and cannot be prevented, but there are steps that a child can take to reduce the likelihood of developing type 2 diabetes. First, maintaining a healthy weight. Overweight children are at risk of developing type 2 diabetes as they are more likely to have insulin resistance. Second, staying active. Keeping physically active reduces insulin resistance and also helps control blood pressure. Third, limit sugary food and drinks. Consuming a lot of foods that are high in sugar can lead to weight gain. Eating a balanced, nutrient-rich diet with plenty of vitamins, fiber, and a lean protein will lower the risk of type 2 diabetes. People with type 1 diabetes are treated by taking insulin every day. You usually take the insulin through an injection, but some people use an insulin pump. The pump injects insulin through a port in the skin. It can be easier for some people than sticking themselves with a needle. It may also level out blood sugar highs and lows. The amount of insulin you need varies throughout the day. People with type 1 diabetes regularly measure their blood sugar to figure out how much insulin they need. Both diet and exercise can affect blood sugar level. In conclusion, therefore, parents should be alert of a child when the child is showing any of the 4 T's. First, toilet. Using the bathroom frequently, infant having heavier nappies or bedwetting from a previously dry child. Second, thirsty. Drinking more fluid than usual but being unable to quench thirst. Third, tired. Feeling more tired than usual. 4, thinner. Losing weight. Take them to the doctor and insist on a screening test for type 1 diabetes. This consists of a urine test to look for sugar in the urine or a fingerprint test in which the child's blood is analyzed to determine their glucose level. That's all. Thank you. Thank you for listening.